Hello, welcome everyone. We're live again. This is our Thursday acne show where I come to you every Thursday and we talk about a different acne topic. Each week we go over all sorts of things, lifestyle changes, product recommendations, routines, dietary things. We really dig into a lot of different topics here. But today we have a very special guest. We have Face Reality's Director of Education with us, Stephanie Criscione. And she is just such a great person. I've had the opportunity to meet with her in person and talk about all things skincare and business. And she just has so many really amazing ideas about how to utilize these products and kind of the lifestyle and dietary things that go along with using the Face Reality products. So today's topic is all about you're clear, your skin is clear. So now what? What's the next step to take? So we're going to dive into that in a second. But first, I wanted you guys to hear a little bit from Stephanie on who she is. Stephanie, why do you love treating acne? What drew you to this? And let's kind of hear kind of your inspiration around acne.
Yeah, absolutely. Thank you for that awesome intro. So, I've been a licensed esthetician for 25 years, and I really did get into aesthetics because of having problematic skin myself. I
Mhm.
experienced really severe acne in my teens and even into my early 20s with just no relief. I mean, I was the Noxzema Sea Breeze girl, just stripping my barrier, making it worse. I was like stage 4 picker, all the things we tell our clients not to do. I was like, the classic doing it all wrong. And I actually got to work with a really qualified esthetician who knew a lot about skincare and specifically acne. And this way predated Face Reality. And she, through her approach, through really educating me on all things acne and how to care for my skin, I was able to control it, as we know, not cure it, but control it, and able to get my skin to a place where it was very, very manageable and I would only have the occasional breakouts. That really stimulated me to want to go into aesthetics. I was always very passionate about beauty and wellness. I was trained as a massage therapist, also holistic nutritionist, functional medicine health coach, and really skin was just like the perfect sort of trifecta to bring that all together. So I started in aesthetics way back in the day. And unfortunately, back then, there just weren't that many treatment options for acne. It was like your classic benzoyl peroxide, even skin treatments were just a little bit more basic and not really understanding the differences in acne, the differences in acne types. And so it was just a much more generalized approach. So one of my first jobs actually out of aesthetic school is working for an acne clinic. So it's no longer in business, but it was the acne treatments clinic here in Walnut Creek. And I just learned a ton about acne, about the structure, function, anatomy, physiology. I got really passionate about wanting to help people clear their skin because I knew how impactful it had been for me, how just devastating it was emotionally, psychologically. And it's become my life's work. My life work to help people now, help estheticians help their clients get people clear. And here we are 25 years later, and I'm still in the game and loving every minute of
Wow.
it.
I love that. I love your story. I love that you've worked in so many different areas that all come together to
Yeah.
treat acne and get like healthy skin that makes you feel confident and feel really good. I want to kind of pull back to something that you said that acne has no cure. It cannot be cured. So, can you touch on that a little bit? Because I think that kind of feeds into this topic today. A lot of people are like, well, why isn't my acne cured? Why can't I just, move on with my life and now use, the La Mer cream at the store every day instead?
No, I completely understand. And believe me, skincare is seductive. I want to use the La Mer $500 face cream all over my entire body, but I would turn into one giant pustule if that were the
Hmm.
case. So the reason it can't be cured is because it is hereditary and it is a genetic skin condition. So the skin of a person who is experiencing acne is just different. You have
Hmm.
more keratinocytes that are produced. You have usually a larger, more multi-bulbed sebaceous gland. So you're producing larger amounts of sebum. There could also be hormonal fluctuations that will affect the consistency of the sebum. Usually, people who experience acne also have a higher inflammatory response. Even though acne is a skin condition, it actually falls under the sensitive skin sort of triad. So, by nature, acne is an inflammatory skin condition and we can treat it, but we can never change the structure of the skin. We can never change
Hmm.
how many skin cells someone is accumulating or change the size of a sebaceous gland. There are certain medical interventions like Accutane that can in theory, shrink the sebaceous gland. But what we've seen time and time again in our practice here at Face Reality headquarters and in my own practice when I used to do clinical work, it doesn't work for everybody. So a gland can get bigger and smaller and bigger and smaller, and it's not always a solution. So really understanding that acne is something that you will have to treat or make skincare modifications around for probably the rest of your life. Now, as we age
Hmm.
and the sebaceous activity does slow down and our skin cell accumulation, or excuse me, our skin cell production isn't as high, we don't need to be as aggressive as you will with some of our actives and things like that. But until you can get that skin clear and keep it clear, you need to be on acne safe regimens. And some
Hmm.
people, a lot of my clients needed to be on acne safe regimens for pretty much their entire lives. Yeah, because
Yep.
they think, 40s and 50s, they want to focus solely on age management and prevention. That's all fine and good. But if you're using ingredients that are pore clogging, or if you're not really understanding how structurally your skin is different, you're going to break out again, no matter what age you are.
Hmm. And let's talk about that a little bit. I see this every day. You have clients who come in who are starting to have these healthy aging concerns, fine lines, maybe some dark spots. But they can't just go out and start buying these products that are marketed for healthy aging or for aging clients because most of these are using heavy occlusive oils. They're not acne safe. So what are some of your favorite products to add into a routine once someone is clear to target fine lines, wrinkles, and aging concerns?
Yeah, that's a great question. And what I always like to remind people is anything that you're going to use to treat acne actually has age management and preventative properties. Any of
Mhm.
your beta and your alpha hydroxy acids, those are going to have age management benefits. Even your benzoyl peroxide, if you think about it, skin aging, inflammation is a huge component. So if we're
Mhm.
using benzoyl peroxide and we're reducing inflammation in the skin, that's going to help. Now, once a client, I'm very adamant that once a client has gotten clear, we have to keep them clear for a minimum of 6 months before we start dabbling in other things. And
Mhm.
that's because of the boomerang effect. No skin cell or follicle is going to turn over at the same rate. So we don't know what we could be inducing or could be contributing to if we go too quickly into some of these age management
That's
and
a great
prevention
tip.
scenarios.
Mhm.
Yeah, no, and I always say, get them clear, keep them clear, then we can start having fun. We can start dabbling, but we never recommend just switching out an entire routine because if somebody starts to have some breakouts or starts to purge, we really have no idea what specific ingredient or product was triggering that. So
Mhm.
I am much more of the progressive versus aggressive. So usually when someone's clear, there's some residual concerns, whether it's post-inflammatory hyperpigmentation, post-inflammatory erythema, atrophic scarring, and there's a lot of things that you can do to address that topically. We love any kind of vitamin A derivatives. We love glycolic acids. Obviously, your Mandelics are going to be our liquid gold. We love them for everything.
Mhm.
However, keep them clear, get them clear, and then introduce those products one at a time. So if there is anything that's sort of happening, you can identify it right away and make sure that we're maintaining skin clarity because acne by nature being an inflammatory skin condition ages the skin faster. So the number one goal,
Mhm.
get the skin clear, keep it clear, then we can start playing around with some of these more sophisticated ingredients and
Yes.
solutions.
I'm glad you said that the products are also inherently, anti-aging. Specifically,
Yeah.
I have clients all the time who are like, I'm using the full routine. I have a Mandelic serum, I have all these things, but I want to add a brightening serum because I have scarring. And it's like, you've got it
Yeah.
right here, your Mandelic serum. So
Exactly.
brightening,
Yeah.
tyrosinase
Yeah.
inhibitor, great
Yeah.
product.
Exactly. And vitamin C's and things like that. So I know that a lot of people do virtual consultations. I know your
Mhm.
business model is very heavy on that. And there's in the treatment room, there's tons of things that we can do. We have our lactic peels. Even though it's not back bar, we implement our Brighten C mask. We've actually come up with a couple fun things for people to do at home. We have this great glow up treatment that includes some of our topical scrubs, Mandelic serum, Brighten C mask. We also have the MS-15. We use that as an at home peel that you can combine with some of our
Ooh.
masks and things to get some of those brightening, boosting effects. So
Mhm.
we're getting really creative because we realize, skincare is very sexy and people want fun things sort of outside of the box, but we always want to make sure that they are acne safe and that we are maintaining the integrity of that clearing process before we start getting
Yeah,
creative.
let's rewind real quick because that was a great tip. So, what she was saying, she said MS11. So, that's the Mandelic Serum 11%. You can use that
Uh-huh.
as an overnight peel. So, if you normally use
Yeah.
your 8%, you could do 11% once a week, follow with just moisturizer, and that's your peel if you're
Yep.
not able to go in and get peels in person. This is a great,
Exactly. And a
great
little
treatment.
fun fact, we even recommend the 15. So the
Ooh.
MS-15, Mandelic Serum 15, historically, we recommend it primarily for use on the back
Hmm.
because the skin on the back is just thicker and denser. If you or you can use that though as a weekly at home peel, really helping to boost those brightening effects, really helping to stimulate that cell turnover, specifically for people who've got some pigmentary irregularities, either post clearing or even summertime. Some people will just get spots from UV exposure. It works fantastic. We're kind of obsessed with that, but I
Hmm.
stress once a
Yeah.
week. This is not
Once a week.
this is not a daily treatment. It's once a week.
I know that is a really common mistake that I see is that if a client is using a Mandelic Serum 11, and they're maybe not quite doing their routine perfectly, or they've got some mismatches going on, so they're like, oh, then my next step should be, if I'm not clear, MS-15, Mandelic Serum 15, and I'm like, no, 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 no.
Yeah,
Let's
yeah.
look at your routine. Maybe you need to bump up your acne med. Maybe you're not using your Mandelic Serum twice a day. There's just all those little hacks that we gotta utilize first.
Absolutely. And, Celine, to your point, people don't always understand what could be triggering their acne breakouts. And at
Hmm.
Face Reality, we try really hard to educate people as with as much information as possible, but more digestible and bite sized. So we always want to ask people in their routine, is your routine addressing the four components of acne? Number one, retention hyperkeratosis, very fancy way of saying too many dead skin cells.
Hmm.
Two, excess sebaceous activity. Three, C. acnes bacteria. And four, inflammation. There is not one product, and I wish there were.
I
We'd,
know,
we'd
I
all be
wish.
millionaires, right? Or you'd be out of business. But I wish
I
there
mean,
was one
BPO
product
comes
that could.
close, but it doesn't
It
give
does. It
you
absolutely.
hydration, which is also
It's
necessary.
yep, and it's not the hydration that would if you're high dehydrated, you're going to overstimulate oil production. So really making sure that your routine is comprehensive and is addressing all of those four components. And that doesn't
Hmm.
mean you need 15 different products. You just need to understand the type of acne that you're experiencing or that your client is experiencing and the targeted solutions that are going to address their unique skin concerns.
Hmm. Yep, that's a great point. So, a quick side note, I get this question a lot. A lot of people say, I've heard that acne med isn't good for your skin long term, that it can cause dryness and aging. Should I be trying to get off of this as soon as I get clear? There's just so many myths about BPO that I find to be untrue because it's such a helpful product to use for acne. What are your thoughts on that?
Yeah, I agree with you wholeheartedly. And now I think if someone is more prone to non-inflammatory acne, they might not need to be on benzoyl peroxide for the rest of their life
Hmm.
because they don't have inflamed acne. We're not seeing an excess of the C. acnes bacteria in that skin leading to inflammation, pustules, and papules. So it really depends on the type of skin. Some of my clients, benzoyl peroxide can be used almost as a treatment product to control and then reduce the C. acnes bacteria, reduce the inflammation. And then once the client is clear, not everybody needs to stay on acne meds. They
Hmm.
don't. A lot of times they do, though. I have seen time and time again people saying, I want to get off acne meds. They don't like that it bleaches their their sheets.
Yep.
I get it. There are some nuances to it that can be a little bit annoying, but I've
Hmm.
seen it too many times that to count that people go off their acne meds and then they stay on their Mandelics or they'll add in glycolics or they'll add in some physical exfoliation. And then they'll start specifically in this sort of perioral region, in these hormonal regions in women primarily start to get more papular pustular activity. So it really is going to be case by case basis. There has been no definitive research that has come out and said that benzoyl peroxide is bad for the skin,
Hmm.
that it causes excessive dryness, any of these things. If used improperly,
Hmm.
it can cause some adverse reactions. That's why we really believe in the timed approach. And listen to your skin. Your skin will tell
Hmm.
you a story. If it's itchy, burny, red, sensitized, back off, lay off of it, drop down a percentage. There's always a way to modify the routine to get great results without compromising your clearing journey.
And that's just a great reminder in general with Face Reality is that it is an adaptive method. We're meeting the skin where it's at and what it needs, and not all skin needs the same thing. And also your skin might
Exactly.
need something different in 2 weeks than it's using right now. So reach out to us. We are here. We have our team of estheticians. They all have done the acne training from Face Reality.
Yep.
So definitely, whether you're seeing us or you're seeing your esthetician at home, contact them, reach out to them, because that really usually is the biggest block to being clear and also staying clear, is just not reaching out and asking us those questions, because sometimes it's as simple as just saying like, okay, yeah, you need to use your acne med every night again for a little while until you get clear again. It could be something simple.
Yeah, exactly. And a lot of times people don't realize about acne meds too is where is it supposed to be working? It's supposed to be working, in the bottom of the pilosebaceous unit. And so if the skin is inflamed, you've got all this blood sort of compressing the follicular channel, you're putting copious amounts of benzoyl peroxide or acne meds on the surface. It's never getting to its intended target. So that's where we get into the anti-inflammatories, the icing, the timed method, because when we see that dryness and that irritation, it's almost always with people who are more inflamed. That's
Hmm.
because the acne meds just aren't getting into the desired target. So I know it seems a little, cumbersome to doing the icing and doing all this stuff, but remember, it's got a route that it's got to get to, and it's
Hmm.
not an easy route. It seems like it's real easy to just get things in the skin. By nature, the skin is not a good organ of absorption. It doesn't want to let things in. So
Hmm.
sometimes just a little boost by using some additional anti-inflammatories or using the icing method could be just the trick the skin needs to really get that clearing process sped up.
That is a really great point and a great reminder to stick with icing because I think that that's
Stick with the
easy to
icing.
forget. It's easy to forget
It,
that because it's not part of your product routine, but it is so important.
it's so important, and especially if you have situational acne. One of the things I used to recommend to my clients all the time: quick little ice massage, put a little acne med on, hit it with an ice pack, hold it for about 10 minutes, wipe off the excess, usually the next day. Now, let's be realistic. The lesion wasn't gone, but it
Hmm.
was completely flat. It wasn't exhibiting any white. Nobody felt the need to want to extract it or
Yep, it caused
excoriate it.
some
And
scarring.
after exactly causing the PIE,
Hmm.
causing the atrophic scarring, spreading bacteria, that whole thing that anybody's listening to knows that
Hmm.
vicious cycle. So, and I think icing also, it feels very cooling. It desensitizes the nerve endings. People are less
Hmm.
inclined to want to touch it, to want to pick at it when you know psychologically you're doing something helpful versus harmful.
Hmm. Absolutely. Okay, I feel like we could just talk forever about
Oh,
every little
forever.
thing. Oh my goodness. So,
Just
I would like to hear from you. What are some of the biggest mistakes that you've seen your clients make once they've gotten clear and they're kind of, navigating the world of being clear?
yes, like too much too fast.
Mm.
So people get clear, and I mentioned this earlier. There is so much out there to treat the skin. I mean, you get on social media, you go on the website, you type in skin. There is everything under the sun, whether it's
Mhm.
microchanneling or lasers or any of these sort of invasive things. So the biggest mistake that I've seen is that people going too big too quick, or
Mhm.
thinking because they're clear now they can completely switch up their routine. And acne doesn't happen overnight. It takes 3 to 6 months to form in the follicle. So someone might get on a really sophisticated age management routine, and
Mhm.
for the first couple of weeks or months, skin looks glowy, beautiful, super smooth, hydrated, and that follicular buildup leading to blackheads and eventually pustules and papules, and then we have to start all over again. So first mistake would
So
be
rough.
thinking that just because you're clear, you're going to stay clear no matter what you use. It's just
Mhm.
is also trying to address scarring too quickly. So, scarring, whether it's pigmentary irregularities or whether it's actually atrophic scarring, the skin needs to be very, very clear for a period of time before we start addressing scarring, because some of those treatments can actually induce purging. So the very thing that we're trying to
Mm.
address, which is
Mhm.
pigmentary irregularities or scarring, now we're potentially stimulating more of that. So in a perfect world, and I know people are not patient when it comes to their skin, but in a perfect world, 6 months to a year before you start doing anything really invasive to address scarring or pigmentary irregularities. Now, I tend to
Mhm.
be very conservative, so this is like my total conservative hat on right now, but I always want to maintain skin health and integrity and just ensure that client stays clear.
I think that's great advice. I do. Um, Real quick, so let's touch on this. I have gotten this question before. I've had clients say, "Well, what do you consider clear?" Like, I have, about two pimples that pop up every month around my period. Is that considered clear? Is it safe for me to, add in some of these other products, or should I wait for that to clear to move on?
I mean, if we look at an IGA score, how many lesions is somebody presenting with? Occasional situational breakouts, I would say that client is pretty much clear. Now, one of the
Hmm.
things that I used to recommend in my practice was cyclical skincare. So if somebody knows that with their hormonal fluctuations or their cycle that they always get a little bit of breakouts around that time,
Hmm.
switch your routine up a little bit. Maybe add in some sulfur spot as a preventative, or add in a little bit of acne meds, or up your percentage of your Mandelics or your serums a little bit that week prior to your cycle, to just prepare your skin for and prevent anything that might be wanting to surface because of
Hmm.
those hormonal fluctuations. Yeah, so cyclical skincare is a big thing for me. And I would always tell people, if you know you go on vacation and you experience acne tropicalis, change your routine a little bit beforehand.
Yeah.
Change your routine while you're on vacation. If you know that come winter time, that winter cirrhosis, your skin just starts to overproduce oil, switch up your routine a little bit to ensure that you stay clear.
Hmm.
And Sulfur Spot's a great treat. I know it's an
Oh,
underutilized
I
SKU,
love
but
it.
it's
Yeah.
actually, I love it. I mean, it is like one little dot on something, it is just gone the next day. And it
Hmm.
works differently. The mechanism of action is similar but different to acne meds. You don't have to do the timed approach. It's a little bit gentler, so you
Hmm.
can just like stick it on and one and done.
Yeah, yeah. And you can kind of even get away with putting on a little bit of it in the morning before you go out in your routine too, which is nice.
Oh, oh, you totally can. I mean, it's hilarious. You'll see people walking around our office here at headquarters with these like blobs of yellow all over their skin. I mean, we're for a skincare company, so hey, there's no shame in our game.
Oh yeah, that's how we are too. We'll be walking around the office with pimple patches on,
Oh,
like just
totally.
not a
I'm
fear
a
in the
little
world.
under eye mask, all the
Yep.
things. We're into it.
Okay, so let's pivot a little bit just to highlight maybe a couple products or one or two products that I
Sure.
find especially helpful for once you get clear. I mean, the most of the time, the main concern once you get clear is pigmentation,
Yeah.
that erythema that's left behind, and
Mhm.
Brighten C mask. I love this stuff. This was actually recently lightly reformulated. It's very
It was.
similar, but it did get some little changes. Could you
Yeah.
tell us what the changes are to Brighten C mask?
Yeah, so we made some changes with there's some stability changes. We are using a new form of vitamin C. We also did a better delivery system, and there's just some additional brightening agents that are in it that weren't in there before. Little fun fact about this mask: we just did some little hand treatments of this just to see. One of our favorite things to do with this is actually a little bit of as an at-home treatment.
Hmm.
Do a little bit of the either antioxidant or mandelic scrub. Do a little bit of that mandelic, either 11 or 15, throw your vitamin C mask on, and it's like, if you can sleep in it, sleep in it. Most people
Uh-huh.
can't, but leave it on for anywhere from 20 minutes and beyond. And honestly, pigmentary irregularities, they're not gone, but noticeable brightening,
Brighter.
noticeable brightness in the skin. Yeah, we did it on our hands and we took like a side by side comparison with pictures. It was mind blowing. Yeah,
Yeah.
the vitamin C mask is one of my favorites. If you're also a little quick fix, if you just wanted, you didn't want to do it for the full time, you can actually, this is totally like off the record, but on our Instagram live, but you can actually mix it with a little bit of the antioxidant scrub, kind of use it as a
Ooh.
scrub
Uh-huh.
mask if you've only got a few minutes just to get a little bit of brightening. Also, if you've got a little bit of like dryness from acne meds or from some of your actives, it can work as a great exfoliator while also giving you a little pump of brightening. Now,
Ooh, I'm
it's
gonna
a
have to try
tiny
that.
bit wasteful with the mask because you want to leave it on the skin, but
Hmm.
sometimes just a quick fix, date night, you just want that nice smooth glow. It works great. Yeah, we're
Yeah.
working a lot here at Fierce Reality. Like, how can we cocktail our solutions and play and have a little bit more fun with some of our products? Because we've got great stuff, and we're definitely trying to figure out like how we can layer and what we can do, and get some case studies for you guys so that we can start getting a little more creative.
Yeah, and I don't know if you guys recommend it. Maybe you can tell me, but I use this as a sleep mask. So
Yeah,
my go-to way
we love
is
it.
that I'll just put this on as the last step in my routine. Sometimes I put Mandelic on underneath, sometimes I don't.
Uh-huh.
But what I just found about this mask is there's not many products that will make your skin look better overnight.
Uh-huh.
Not many at all. And
No.
it's fine because most products don't need to do that, but
Yeah.
this one does.
I couldn't agree with you more. I've tried. I'm a texture person, and I run very very warm. So I've tried. I've woken up in the middle of the night. I've got it in my eyes because I'm sweating. And so if you can handle, like to Celine's point,
Uh-huh.
if you can handle the texture, and if you just put a little tiny bit
Tiny
on,
bit.
then yeah,
Yeah, rub it
tiny
in like
little
a
bit.
little bit of
Yep.
moisturizer. Hmm.
As if it were a moisturizer and sleep in it. Yeah, you wake up the next day with like you've got your glow up for sure.
Mhm. It's amazing. I think I have to request that you guys make a moisturizer with some of these ingredients because it doesn't quite work as a moisturizer. Like I've tried to
It
use it
doesn't.
during the day under sunscreen. Don't do
It
that.
doesn't.
Use it as a
Yeah.
sleeping mask only. But if it had like a slightly lighter texture, you could just
Yep.
wear that every single day.
Well, I can't spoiler alert, but I can say that we have a lot of really exciting things in our innovation pipeline, and there are a lot of fun things that we're going to be coming out with in the next months and years that address a multitude of skin concerns that are all acne safe. So it's
I'm so
coming. Things are
excited.
coming.
Yeah,
Uh-huh. Yeah.
I'm really excited.
Yeah.
Okay, so we're starting to run out of time. So let's see if there's questions.
Great.
Ben's gonna give me the phone here. So if you guys have any questions, get them into the chat right now, and we're gonna get on it. I do see them over there. I can see them on his computer. questions. Okay. So, any suggestions for breakouts on the chest?
Absolutely, yes. So the skin on the face, neck, tops of the shoulders, top of the back, and chest is exactly the same. It's all the same skin. Skin is a little bit more sensitive on the neck than it is the face. There's just more blood vessels and you've got some of your carotid arteries here. But honestly, whatever you've got on the chest, or excuse me, whatever you're treating your face with, you can absolutely treat on your chest. So just, I always say, your face starts here. So just bring everything down. You can use the sulfur spot. You can use the acne meds. A lot of times people will, especially when they're doing their routines at night, they don't wash their neck and chest because
Mhm.
you don't want to make your, you don't want to
It's
turn your
messy. I
bathroom
get it.
into a
Yeah.
lake. It's messy. I get it. But if you can get any dirt, makeup, oil, debris, especially for people who exercise, females, you get a lot of sweat that will go like in between the chest. You got to get that stuff off. So
Mhm.
cleansing the skin, cleansing the neck and chest at night is equally as important as cleansing the face. And any of the products that you're using on your face, you can absolutely use on your chest, shoulders, upper back, anywhere you're experiencing breakouts.
Yes. And another quick tip I've been noticing, so a lot of natural perfumes are getting really popular, perfumes that have more of like an essential oil base. But a lot of these essential oil bases have coconut oil as the base. So I've
Mhm.
actually seen at Sephora, there are some like all natural body sprays that people spray right here because that's where you put your perfume, but it has coconut oil.
Uh-huh.
So double check your body sprays.
Yeah, and I couldn't agree with you more. I always tell people do not spray any sort of fragrances and things on your chest.
Hmm.
If you're going to do it behind the ear. Worst case scenario, if it causes pigmentation or you have an adverse reaction, it's behind your ear. No one's
Yeah.
going to see it. But yeah, I've seen time and time again, especially when, the 80s and 90s when perfumes were so popular.
Yeah.
A lot of my older clients have a noticeable pigmentation in this area from constantly spraying fragrance on their skin. So
Hmm.
yeah, not that perfumes are a no-no, just don't spray them around the moneymaker.
Yeah. Be creative with how you use them.
Yeah, exactly.
Okay, Michelle would like to know which Face Reality vitamin A serum is best for anti-aging. She's 33 and clear, so she wants to focus more on anti-aging now.
Yeah, I like our retinol peptide serum. It's
April.
it's by because it does have the vitamin A, so you're getting oh, you've got it right
I got
there.
it.
Yay. So it's got the vitamin A, so you're going to get those skin building molecules as well as the peptides that are going to stimulate new tissue formation. So that is tried and true, especially at 33. You're still very young. Your cells are still turning over, but every year after the age of 20, we're producing about 1% less collagen and elastin per year. So from
Mhm.
20 to 33, you're seeing about 13% in theory, like less than you were producing when you were 20. So anything that we can do to boost that collagen elastin synthesis would be great. And getting that extra little uh, additive of peptides is just gonna keep that skin nice and
Yes,
thick.
I love retinol peptide serum. It is
Yeah, I
so good.
love
It
retinol
is
peptide
pretty
serum.
potent. So I don't know,
It is.
most people can handle it, but I have sensitive skin. So you started with using it only twice a week and then I slowly increased.
Yeah, for anyone who is sensitive, sensitized, or even compromised, I am much more of a slow and steady wins the race. So I'm an advocate of doing it progressively, not aggressively. So I would
Mhm.
usually recommend my clients start out twice a week for two. It's just easier this way. Twice a week for 2 weeks, 3 times a week for 3 weeks, 4 times a week for 4 weeks, and then if you can tolerate using it nightly, and I know the medical community is like, just burn your face off, start using put retinol every night, overnight, and just deal.
With glycolic
That's not
acid.
our approach with glycolic acid. And I don't think anybody wants to walk around looking like their face is a hamburger. Plus,
Hmm.
as we know with acne, that can induce an inflammatory
It can.
response, which could potentially trigger an acne breakout. So yeah, slow and steady with your retinols, but once you can acclimate to them, they are a game changer.
Hmm. So good. Oh, and a follow-up question from Michelle. She also wants to know which moisturizer would you pair with it, with the retinol peptide serum?
I would do the cran peptide.
Hmm.
Yeah, cran peptide. It's richer. It's just going to be a little bit more nourishing than the clear derma. I know that sometimes spreadability is a little tricky with that one, so I love it as well. It just sometimes texture can be a bit tricky getting it into the skin. You can actually mix it with a little bit of moisture balance toner. So one of the things that I do,
Ooh.
I actually just put my moisture balance toner in a spray bottle, and I'll put a little bit of cran peptide, spritz some moisture balance just to thin it out. You're still getting all the benefits of the cran peptide. You're making it a little bit more spreadable and you're getting a nice hydration layer on the skin. And then you've got that occlusive nature of the cran peptide. So you're trapping that moisture in. The skin just sucks it up. You'll feel really, really hydrated and smooth. And it'll help the water as a transfer ingredient. So it will actually help pull the moisturizer even deeper into the skin.
I love doing that. That is like my favorite
Yeah. Oh,
hack. As
my
someone with
favorite.
oily
Yes,
skin, I often want to use heavier moisturizers because they have the ingredients that I want, but I don't want the weight.
exactly.
So mix it with a
Exactly.
mist, a toner. It's just, yeah, a great tip.
Yep. Yep, it's more breathable that way, so you
Hmm.
don't have to worry about the occlusion and the increased bacteria. Yeah, it's a fantastic way to, like Celine said, be able to use some of those more fun, fancy moisturizers,
Yep.
but not have the true occlusive nature affect your skin.
Yeah. Okay. Jess wants to know what is the best for textured acne scarring?
As far as an over the counter, like a topical product, that's tough. I mean,
Hmm.
because texture can be lots of different
Hmm.
things. Is it textural build? Is it textural buildup? Are we just having, too many skin cells on the surface? If that were the case, I would say probably your alpha hydroxy acid, because that's a superficial exfoliant that's really working to break apart the binding that's holding the dead skin cells on the surface. If it was more an atrophic scarring, something that was underneath the skin, truth be told,
Hmm.
retinols, but it's only going to take you so far. I
Yeah.
never want to disillusion anybody. You will get some of that buildup in the collagen elastin matrix that will help lift up the scars, making them appear less visible. But if it is true texture, like unevenness, pock marks, things like that, you do have to go a little bit more invasive. Some of your
Hmm.
deeper chemical peels or microchanneling, microneedling, some non-ablative laser treatments. There's lots of options out there. We don't have official positioning on that yet, but we're working on it. But there are some fantastic options for texture and for
Hmm.
scarring.
Yep, I agree with that. Sometimes you just need a more intensive approach, and you just have to
We
admit
do.
that topical products can only do so much when it comes to those deep pitted scars and things like that.
Absolutely. I mean, at that point, we're trying to address that's more of an internal. I mean, if you're seeing a scar, that's truly in the dermal matrix. So we're trying to
Hmm.
address something internal with a topical solution. It just doesn't always work. So, I mean, it can only get us so far. If you really want that deep dive and you want that really smooth, even skin, oftentimes you have to go a little bit more sophisticated. I won't even say
Yeah.
invasive, a little more sophisticated.
Yep.
And we're not opposed to any of those things. We just
Yeah.
don't have official protocols in it. We don't do those in our clinic here
Hmm.
at headquarters, but we are not mad at it. We are all
Hmm.
about it. Anything that people want to do to have clear, glowing, radiant skin, we support it.
Yeah. Yep, I agree with that. Ooh. So Amy loves to do sulfur spot mixed with Hydra Balance. I think
Oh yeah.
I've done that a couple years ago, but I kind of forgot about that. That's such a good tip.
Yeah, people love it, especially if they're prone to inflammatory acne. Love it. No, we recommend it all the time. People do it all the time in our clinic. So yeah, yeah, you can definitely mix it. Careful around the ocular rings. So just be careful
Mm,
around the eyes, also around the mouth. Actives can travel sometimes up to an inch from wherever you put them. So if you're getting it too close to the eye area, it could be a little drying. Also, the lips, mucous membrane, they don't really have a lot of sebaceous glands. So just
hmm.
be careful not to get it too close to those areas. And then
Yes.
the neck can be a little sensitive as well.
Hmm. Great tips. Okay, what do you recommend for treating congestion on the nose? Not quite blackheads, but congestion. So it sounds like maybe some sebaceous
Sebaceous
filaments.
filament. It's hard. So sebaceous filament's just going to be there. I
Hmm.
mean, it's basically what you're seeing is just an accumulation of dead skin cells and sebum. And the way that we get the skin naturally purges that is the hair. It wicks it out. And if you look at the nose, there's not a lot of hair on the nose, right? And there's just the nose is mostly cartilage. So it's tricky. I mean,
Hmm.
acids do tend to work like a beta hydroxy, specifically like a salicylic, would probably be my recommendation because it would just help lift the sebaceous filament out a little bit more. You can definitely extract it. It will come back. I mean, you
Hmm.
squeeze the nose, you see the little worms come out. That's basically sebaceous filament. You can extract it. They will come back. But we've seen great results with anything beta hydroxy. So
Hmm.
anything like salicylic based. The trick about salicylic though is you have to use it all the time.
Hmm.
It can't be used as a spot treatment. It really needs to be used at least once a day, sometimes even twice a day. So like Salcy toner
Hmm.
on a little cotton ball, especially like a structured cotton ball to get a little physical exfoliation could be helpful, or even the Southwest serum, just a little bit on the tip of the nose can be helpful. Yeah.
Yeah, Salsi toner is great. And that one you can use
Yeah.
every day. It's not going to be overly harsh or anything. So that's a great option.
Yeah, I love that for myself. I still do get some filament in through my nose and chin area. Like to use that on a little bit of a structured cotton,
Hmm.
and just kind of give it a little bit of a physical manipulation as well, and it works great.
Yeah. Okay, let's see. Ooh, okay. So Aston wants to know they love the tip of using Mandelic with Brighten C. So they're curious, what are other serums that can be layered under Brighten C or the Hydrocalm mask?
I mean, kind of anything. I wouldn't do any of our vitamin A serums
Hmm.
because those are really intended to be sort of the star of the show. But you could do the glycolic serum. You could do any of the Mandelic serums. I don't think I would do the salicylic serum. I mean, you could. It's not gonna. It
Hmm.
wouldn't harm your skin, but that's more of a topical product that you would use for like home care versus treatment. So if you were using the Brighten C mask to do an at-home treatment or an in-office treatment, I would say your Mandelics or your glycolics are going to be your best bet to
Okay,
pair them with.
cool.
And I know some of our acne experts will do some hydrodermabrasion or microdermabrasion, some others like dermaplaning and things,
Hmm.
and use the Brighten C mask and have great results with that as well. So if anybody, any of your clients or consumers are doing any of those treatments, they pair really well together.
Hmm. Yeah, really, they, especially Hydrocalm specifically, layers really
Yeah,
nicely with everything. In the winter,
everything.
that's usually my nighttime moisturizer every night. It's just
Yeah.
Hydrocalm because it has like a
It,
gel cream consistency, soaks in
uh-huh.
nicely, feels good, and it's just lovely.
Yeah, I'm an avid snowboarder, and it saves my skin in the winter time
Hmm.
because I mean, it is, just from the cold, all that moisture gets pulled out of the skin. So that is the one time that I will suck it up and use the Hydrocon mask as my nighttime moisturizer. Even if I feel a little sticky, you just wake up the next morning and your skin feels like glass. It's so
Yes.
nice. And it's able, because of all those really hydrating ingredients, it's able to retain that moisture
Hmm.
a lot longer than, let's just say, a traditional moisturizer.
Hmm. I agree. It's such a lovely mask. When you guys released, so it's been a while, but I still have like a very specific memory of when you guys released your three masks and just
Uh-huh.
like the brightens. I mean, of course, I love the clay mask too. It just doesn't end up in my routine as much because I don't tend to remember to do wash off masks. Like I do
Uh-huh.
my whole routine and then I'm like, oh shoot, I was supposed to do a wash off mask. But a sleeping mask
Yeah.
is different because I can do it at the end of my routine before I've
Yep.
forgotten about it. Um,
Totally.
yeah, but those two, Brighten C and Hydrocalm, have just been staple products now because they're Brighten C is like overnight brightening, Hydrocalm is overnight like glass skin, no redness in sight, just calm, happy skin.
Agreed. And some of our acne experts have shared that their clients love to use the Hydrocalm mask as a lip mask, that it works great as a lip mask. So
Ooh.
doing a little bit of, especially in wintertime when we have so many people experience dry lips,
Mm-hmm.
doing a little bit of a physical exfoliation like the antioxidant scrub, and then putting the Hydrocalm mask on it as a treatment mask. They love it, especially
That's
our
amazing.
Midwesterners where it's just super, super cold there.
Uh-huh.
Yeah, they tend to love that.
I'm gonna try that. I'm definitely gonna try it. I
Yeah.
get very dry
Uh-huh.
lips in the summer.
Me as well.
Okay, last question here. Any tips for back acne?
Oh, it's tough.
It is
Yeah.
hard.
First of all, the difficulty is getting back there,
Mm-hmm.
right?
It's
So how do
hard to
you get your
reach.
products back there? Maybe you have like a friend who wants to help you out and throw some stuff on your back. So anything that you are using on the face, use on the back. Now remember, the skin on the back is the thickest skin on the entire human body. So it's gonna be more resistant to
Mm-hmm.
treatments than, let's say, the face. For anybody who's wearing tight, I see a lot of like athletes and people who work out get back acne from tight garments, whether it's be a sports bra or tight t-shirts. As breathable fabric as possible when you are sweating, that's huge.
Mm-hmm.
If you do work out and you tend to sweat a lot, get the sweaty clothes off as soon as you can because that bacteria will induce inflammation. It could stimulate more breakouts. We don't sell them, but they've got a lot of fun tools on Amazon,
Mm-hmm.
back applicators and things
Yes.
that have, I always recommend the ones that have the little pads that are single use because if they're the sponges, you're just going to waste a ton of your products. But there are some amazing, I don't know if maybe you guys sell them too, any back applicators or
We
anything on your site,
don't. I know,
Celine?
maybe we need to
Oh,
sell
maybe
that.
something to consider.
An AOS
Yeah, I would say
branded back applicator.
I love that, right? With the little reusable pads that are maybe have your logo on it. How cute.
All
You can
right.
hire me for your marketing team. No
Yeah.
problem. But yeah, so any just getting it on the back and they do have some wonderful back applicator tools. If work on your flexibility, try to
Yeah.
really reach back there as much as you can, but treat the back just as you would the face and know that
Mhm.
it can take stronger active. So like we almost never recommend Acne Meds 10 for the face because it can be a little caustic or inflammatory. It can
Mhm.
work great on the back. Mandelic 15 was meant to be used on the back. So
Yes.
yeah, just get it on there and know that the back will the purging on the back is going to be more pronounced. The lesions,
Mhm.
because there's so much more skin for the follicle to spread into, they'll be more red, they'll be more painful, they'll be more irritated. It'll probably take longer to clear, but be patient, stay the
Mhm.
course, and yeah, just throw some heavy hitters at it.
Yep. I agree with all that said. It was perfect.
Amazing, great.
Okay, so we got through the questions. Thank you so much for joining me. This
Oh,
was
thank you,
such a
Celine.
great
This was so
conversation. I feel
fun.
like we could dive into
Absolutely.
all the science and all the little
Yep.
things for so long.
Yep.
I love that you really bring that science approach to acne care, which somehow
Thank
gets
you.
forgotten sometimes, even though it's so important. Sometimes we forget to dig into the root causes and really the science of the skin, and we focus on all the ingredients and the products, but it's just really important to think about the science.
Agreed. You
Hmm.
you said it perfectly. Yep. Anytime you want to nerd out over all things skin, you let me know. Call me up.
Yeah, we'll
I'm
bring you
ready.
back. You're gonna be back soon, I'm sure, and we'll nerd
Great.
out some more.
Can't wait. Awesome. And thank you so much to all your listeners. This was really fun.
This was great. Thank you so much, Stephanie.
Okay. Awesome. Bye, guys. Have a great rest of your
Bye,
week.
everyone.
Okay. Bye.